Palliative care is a different business model. It's really modeled as far as a business foundation after a physician practice. It is Medicare Part B as opposed to hospice is Medicare Part A. So it has some different nuances for billing, right? So Part B, Medicare, they cover 80% of the charge and the patient has a 20% copay. So it operates just like if the patient was going into a regular physician's office. But for billing, that means there are multiple layers of billing and touching a claim or a balance. So there's a primary payer, which is typically Medicare or a Medicare Advantage plan. And then most patients have a secondary or supplement. And so the balance doesn't go to the patient, it goes to the supplement. And so you're billing primary, secondary, and then for some patients, if there's a balance, then it may go to the patient or family, depending on the business model. Some palliative programs are set up as nonprofits and they have financial thresholds where they may or may not bill the patient. It definitely operates differently just as far as how frequently you bill. The cycle, hospice is billed on a monthly cycle and that's a Medicare requirement, where palliative is billed per visit. As our population ages, that's going to become a service that's going to be more and more needed. As far as the billing perspective goes, again, it is a claim that has to be touched multiple times. It is a higher volume of service because it is billed per visit, and there are a lot of different platforms, EMRs, solutions for billing. But because we have established all of those solutions within our team already, it's usually a much easier onboard with us. And just like any other clinical care provider, of course they need to collect their money so they can take care of their patients and pay their bills just like any other business, but their focus is patient care. They aren't wanting to focus on, did we collect all of our money or why are we not collecting our money? And that's a huge thing in a care model, because how do you keep the lights on and pay payroll, if you're not collecting your money? So where it can't be the physician's focus, it's important and it needs to be someone's focus. And we love to take on that role so that we can support their business and so they can take care of their patients.